The Biden administration is preparing for a legal fight over recently announced vaccine mandates for federal workers and large companies. Nearly 24 Republican governors have come out in opposition to the requirements that will impact some 100 million Americans. At least 3 have threatened to take legal action. Companies will need to mandate vaccinations or weekly COVID testing if they employ 100 people or more. That same testing option doesn't exist for federal workers or those who do business with the federal government. The Biden administration says that the rules are needed to stop the increasing spread of the virus and to save lives. But opponents claim that the move is un-American and the president is overreaching his authority. CBS News researcher Max Baer joins us now for more. Max, so how would the Biden administration argue that the vaccine mandates are in fact legal? How is that all going to stand up in court?
So the Biden administration is really going to be relying on the 1970 OSHA Act. And that says explicitly that employers, and I'm reading directly from this here, quote, shall furnish to each of his employees employment in a place of employment which are free from recognized hazards that are causing or are likely to cause death or serious physical harm to his employees. So the Biden administration is going to make the case that the Delta variant is doing just that. It is potentially causing harm to employees and thus giving them the legal leeway to mandate vaccines or legal testing, saying that that's going to be necessary to make workplaces safe. One public health law expert told one of our associate producers, Ariana Freeman, quote, there aren't 2 sets of facts, there aren't 2 sets of scientific conclusions just because someone believes there isn't a hazard. So law experts believe that this 1970 Act has enough legal standing for the Biden administration to utilize, and there seems to be confidence in the administration that that will work out in court.
So, Max, the U.S. recently passed 40 million total COVID cases. Remind our viewers which areas of the country are seeing the biggest increases right now.
Certainly. So after seeing a lot of cases rising in the South for the beginning of this summer, some of that has actually crept north. States that are seeing particular increases right now would be Ohio, West Virginia, North Dakota, Maine. Pennsylvania is also one of those states. But it's important to note when we talk about this particular moment in infection trends that children have been making up a larger portion of infections as well. The latest data from the American Academy of Pediatrics last week found that children were more than 1 in 4 new cases, with a record high overall total, more than 250,000 new cases reported among kids. And interestingly, even though overall infection trends are kind of shifting north in terms of states with the largest increases, southern states make up about 55% of those 250,000. So you're seeing kind of 2 different tracks of why cases are remaining elevated. Cases rising in adults in some other states that maybe we're seeing flatter case trends earlier this summer, but also rising infections in children, which is being buoyed by the South.
Well, Max, a recent CDC study showed that nearly 2/3 of adults who tested positive for COVID-19 had symptoms that lasted for more than 4 weeks. Tell us, what more are researchers learning about so-called long-haul COVID and its impacts that extend beyond just that immediate time period?
That's a great question. And I think long COVID has clearly become one of the hardest COVID symptoms for researchers to grapple with because of just the wide diversity in symptoms and prevalence. So to that first point, the prevalence of long COVID is something that researchers are trying to get a handle on. That CDC study you referenced had a range there from 5 to 80%, so a very large range that folks are trying to narrow down. A different study from April found that 2/3 of non-hospitalized COVID patients sought outpatient care 28 to 180 days after diagnosis for COVID-related symptoms. Most of those died down at 60 days, but there were some that persisted to 120 to 180 days. So it's talking just about prevalence there, where folks are trying to nail down, how long are the COVID symptoms and for whom. The other question is, what are those symptoms? So in that study that you mentioned, the most prevalent symptoms were shortness of breath, change of taste and smell, and fatigue. And then the final question is, well, how do you treat this? And full treatments are still not really known for long COVID, but in that study, more than 1/4 of folks believed that the vaccines actually improved their long-term COVID symptoms. So long story long, you basically have researchers trying to narrow down how many people does this affect, what are some of the telltale symptoms that maybe aren't as noticeable in people who without long COVID, and how do we treat it? So they're narrowing that down, but there's still certainly a lot of work to do.
All right, that one was long story long. Maybe this one's short. Right now, in the U.S., the vaccine's approved for people 12 and older. Max, when are we going to see approval for younger children?
This will definitely be a shorter story. I will not be so long-winded. We could see a vaccine in children maybe as early as late October. That's the latest reporting, according to Anthony Fauci in a town hall with NIH workers on Friday. Though I will mention that Fauci's notes to the town hall were based off of Pfizer submitting its EUA at the end of September. Dr. Scott Gottlieb, former FDA commissioner and board member of Pfizer, told Face the Nation that that might actually come around early October. So this is a fluid situation in terms we actually get that stamp, that authorization, and shots are going into arms. But tentatively, it's looking like the timeline is going to be end of October, maybe the first couple of weeks of November, based off of the available information from, Dr. Gottlieb, a board member, the company, and some of the top public health experts.
And then still, of course, several weeks after that before that vaccine actually kicks in. So, Max, last question for you. Healthcare providers are expected to start offering booster shots a little bit more than 2 weeks from now. What will that rollout look like?
That rollout completely depends on what regulators are going to decide to do with that vaccine. So, as you mentioned, the Biden administration had come out a couple of weeks ago basically promoting a booster policy that would be for anyone who had gotten 2 doses of the vaccine 8 months after that second shot, beginning on September 20th. Since then, regulators have kind of said, slow your roll. We had, CBS had reported that a couple of the top public health officials, including the FDA commissioner and CDC director Walensky, had informed the White House that there wasn't yet enough data on Moderna's booster dose. So that authorization may come a little bit after Pfizer's, and thus, because of the supply, we might need to tamp down the availability around September 20th. And regulators still need to give that okay to what that group is going to be. FDA's regulators are going to be meeting on September 17th to talk about Pfizer's booster data, and then that will inform the agency's decision on whether to authorize. Then it will go to the CDC's advisory committee, and they'll actually take that authorization and tailor the population that they're going to recommend that to. Tentatively, based off of the last meeting that they had at the end of August, there seemed to be some skepticism about okaying a booster dose for everyone, 16 plus. And it looks like it still is to be decided, but one of the tentative groups that they had discussed were at-risk populations. So that would be healthcare workers, people over 65 who might be at higher risk of waning immunity after that second vaccine dose. So it remains to be seen exactly who's going to get that shot, but it does look like for some people right around September 20th, at least highest risk populations, that could be slated at the end of this month.
All right, Max, thanks so much.